recording this meeting. And we have everyone on mute. Some ground rules for the meeting. Everyone's muted. Please leave your video muted as well, except for Dr. Scholl and Sam. If you do have questions, please go ahead and put those questions in the chat. If you cannot use the chat because you're calling in, we do have the ability to send us a text message. That number is 207-370-2072. Once again, 207-370-2072. We'll post this meeting later on our YouTube channel. If you haven't done so already, please consider subscribing to the YouTube channel. Hit the like button and notify button, and we'll let you know as soon as we post new stuff on that channel. And without further ado, I will hand it over to Director Hurley.
Good afternoon, everyone, and thank you once again for joining us for the COVID-19 briefing and update. As you all are abundantly aware, the COVID-19 pandemic, although we are somewhat in the recovery phase, it's not over. And the recovery phase and the response phase still have overlap. And as we are becoming abundantly aware, the Delta variant of this virus is particularly problematic, and we will spend a large portion of today's meeting kind of venturing into what that means for EMS clinicians, what that means for the healthcare system, and what it means for the EMS system overall and our continued response to this pandemic. As always, I want to thank each and every one of you for your continued efforts in supporting our response throughout the state of Maine, whether that's COVID-19 response or even just the simple everyday calls that you're responding to. We understand that this is extremely stressful, and we hear the stressors that you're all undergoing on a daily basis. And for that, we are immensely grateful for everything that each and every one of you are doing. We understand that COVID-19 adds just an additional layer on top of an already stressful position. And so, as always, we would like to continue to iterate our desire for EMS clinicians as well as agency leadership to support your staff by referring them to resources that are available locally in your community, whether that be peer support or the resources that are available on the Maine EMS website on Stay Healthy and EMS. There are nationalized resources. The Maine Frontline Warm Line was retired in the end of May, I believe, if I'm not mistaken. However, if people still call that number, that is fine. They will still refer people out. It just means that there's not someone on duty to have that call specifically referred to them, but they are still referring those calls. It just may mean a little bit longer wait time to have a callback. So people can still activate that number. They can still call 211, but just know that that was sunsetted because there was little to no uptake. In the previous 3 or 4 months, there had been one call. In, I believe it was over 4 months, there had been one call. And so they retired it because of the resources they were investing in it. But please know that you can still activate that line. You can still call it. It just may mean there's a little bit of a delay before someone calls it back. And there are an immense amount of resources available locally. I know that peer support teams are willing and able and ready to provide support to the best of their ability. I know that there are a variety of mental health workers in the area that are certainly more than willing to chat with people, even if it's not like on a clinical visit. If it's just a conversation, I know that those people are willing and able and eager to provide that support. So please encourage your staff to take care of themselves, to do everything they can to do so. I'm not going to venture into some of the other details because we're going to get into it as we venture through this update today. We are going to start with Dr. Scholl. He has a short presentation where we're going to start with the Delta variant and set the stage for our further conversations of what that means for EMS and our healthcare system. So Dr. Stoll, I'll turn it over to you, and I'm sure you probably want to share your screen for those slides, maybe.
Thanks, Sam. Can you see my slides and hear me?
Can on both.
Great, thank you. And I just want to reiterate Sam's appreciation to everyone for attending today and for your continued attention to this subject. It means a lot, especially as we evolve throughout our response to the coronavirus. We wanted to bring this concept of the Delta variant to everyone today because it is a significant game changer. This has been in large part related to some of the major news you've heard about changing guidance from the federal CDC. It's definitely related to some of the other news you've heard around the state regarding the pandemic. I also want to just reiterate before we get into this, how important it is to look out for each other and for yourselves, work on our personal resiliency, help each other. We've always said this is going to be a marathon, not a sprint, but we're now learning just how long this could persist. And this is certainly one of the longest events that any of us have responded to. Maintaining your resiliency, maintaining your peace of mind, keeping yourself strong to continue serving others has become challenging to everyone I know, but becomes paramount right now. And as we'll talk about, it's especially important to double down on all of our protective postures at this very moment. These slides are, these are talking points or slides that I'm afraid some of you have seen already. I apologize for that if you've come to the MDPB meeting earlier in the week, or you attended some of our local EMS meetings through the hospital I work at. You've seen some of these before. I hope that reiterating these points is actually helpful and beneficial. So as a starting point, I just want to point out that the CDC has been tracking variants all along. They have three categories. There's variants of interests, and in brief, those are variants that might cause a problem. There are variants of concerns in which there's evidence that those variants can and perhaps will cause a problem from increased transmission, increased severity, or the effect or a minor effect on medical countermeasures. And there are variants of high consequence, and those are variants that have clear evidence that preventive measures or medical countermeasures, treatments, et cetera, have significantly reduced effectiveness to the variant. Luckily, we don't have any variants of high consequence to find right now, but we do have a number of variants of concerns, including the Alpha variant, or what was known as the UK strain. That was the strain back in December that we heard about with a higher risk of transmission. There's the South African variant, there's the Brazilian variant, and those are also known as Beta and Gamma. And then there's the Delta variant, which was first discovered in India, and now, as we'll see in a second, is the most prevalent circulating strain throughout the US. I'm going to focus on the Delta variant. This is a variant of concern because of increased transmissibility. That's one of the big game changers in this variant. We'll talk in a second about just how much increased transmissibility Delta brings. There's also the potential for neutralization of two of our most commonly used monoclonal antibodies, or MCAs, and there's a potential for reduction in the effectiveness of post-vaccination sera and what we call convalescent sera. And finally, we're trying to learn, or we're actively learning more about the change in virulence of the Delta variant, and early reports suggest there's increased virulence of the Delta variant as well. So it spreads faster, it's much more transmissible, and we believe, based on information we have right now, that it is going to be more virulent as well. And it does have the ability to bypass some of the more common treatments we have in the form of MCAs or monoclonal antibodies and convalescent and post-vaccination sera. So that's what makes Delta so dangerous right now. Specifically, thank you for lunch.
Welcome.
Specifically, let's talk a little bit about this transmission issue. I don't want to belabor or get too much into epidemiology, but there's a phenomenon called the R naught, which is the number of people an infected individual is expected to infect themselves. As we talked about in the early parts of this, the R naught of the original Wuhan virus was 2.5-ish. That's important because in order for a disease to dwindle on its own, it needs to have an R naught less than 1. And so an R naught of 2.5 is considered pretty high in the world of infectious disease. The first variant that caused disease in the spring of 20 in places like Italy had an R naught of 3. The UK variant, or the Alpha variant, has an R naught of somewhere in the mid 4 range. And that's we knew that the Delta was higher, but in the last month, we've learned the Delta's R naught is closer to 5 or even up to 8. And to give you a sense of perspective, some of the most transmissible diseases that we know of, measles, for instance, has an R naught of 18, and something else like mumps has an R naught of 12. So this is really, really significant. Last month, the CDC was predicting that the Delta variant would be the most common circulating variant in the US. This is all the different dates and the breakdowns of the different strains dating back to May of this year, in which case you see this very small line right there of dark orange was the Delta variant at the time. And notice that the Delta variant, this orange line right here above the dark line is the Delta variant. And notice it's increasing relatively exponentially. And at this point in time, accounts for somewhere over 80% of all the circulating coronavirus in the US. If you add up all the CDC statistics, it's close to the high 80s, low 90s. So this is out there. It is the predominant strain right now in the US. If you look regionally, there certainly are places like the Rockies in which the effective Delta is higher. But even in the Northeast, we have more than 75%, probably approaching 80 or more than 80% of our cases right now are the Delta variant. And that's true for the entire country at this point in time. Delta is the most predominant strain. And again, Delta is a game changer because it's much more transmissible. It has the ability to bypass some of our common therapies. And early indications are that it is more virulent. This has led to a significant impact across the country. This is updated as of, I believe, today or yesterday. Yesterday, it looks like. This is from the CNN folks who are looking at coronavirus numbers across the US, and notice that we're starting to see a relatively steep increase in a relatively short amount of time. In approximately 4 weeks, we've seen an increase in coronavirus levels and daily cases that rivals anything we've seen as a country, except the winter surge we had between November, December, January, and February. We are at present as a country worse than any other time as far as daily numbers go. Unfortunately, what we know is that numbers precede hospitalizations, which are now starting to increase across the country. And while we haven't seen an increase yet, we expect to see increasing mortality. Again, numbers come first, followed by hospital admissions, and lastly, followed by deaths, unfortunately. So we expect to see that same trend with the Delta variant of coronavirus. And to share with you just how impactful this is in some parts of the country, at this very moment, a couple areas of the country are affected more than others, including the Southeast, the Southwest, and the Plains. And this is a statement from a Louisiana intensivist who says that his hospital, his intensive care unit, is admitting 1 patient per hour right now because of Delta variant and lacking vaccinations. We know that no vaccine is 100% effective, and we all learned in December when we were learning about the coronavirus vaccines, both the Pfizer and Moderna and the Johnson & Johnson, that the efficacy was somewhere in the 95 to 94% for Pfizer and Moderna, based on the circulating strain of coronavirus at that time. We know in Maine that we have seen breakthrough infections. We've seen breakthrough infections throughout the life of the pandemic. And as of recently, as of the 30th, there have been 656 breakthrough infections in the state of Maine. If we look at the federal information, the CDC has been tracking both breakthrough infections and now spending a lot of time with looking at breakthrough infections that lead to hospitalizations and lead to mortality. And so as of about a week or 10 days ago, there were more than 163 million people in the United States that had been fully vaccinated. And of those, there had been 6,587 patients who had a vaccine completed, were through the 2-week period, and had a breakthrough infection that led to hospitalization or dying. If you look at those numbers, it turns out that the rate of hospitalization in the vaccinated individuals is well less than 1%. And the rate of death related to coronavirus in those who have been fully vaccinated is even smaller. What that means for us is that the vaccines are doing their job preventing serious disease and death. But what it also means for us is that because of the increased transmission related to Delta, and because the Delta variant is the most common circulating variant in the US, including our own region right now, we have to do more to prevent the spread of disease. And that more, I'm going to bring you back to this slide, which I hope is familiar to all of you and reminiscent, because this was the slide that we used in the coronavirus vaccine education in December as the MDPB did the town halls. And the metaphor of personal protection gear in the context of fighting fires is as true now and maybe even more so than it ever has. If we use that metaphor of turnout gear, we can think of the coronavirus vaccine as SCBA, but we would never enter a burning building with just SCBA. We would always want our helmet. We would always want our turnout gear. We would always want our boots, our glove, our Nomex, our bars, our pry devices, etc. And the same then holds true now, that our personal protection, the protection of our workforce, the protection of our patients, and the protection of our loved ones is reliant on a whole system of protection against the coronavirus. The vaccine is essential. Please don't read this message wrong. The vaccine needs to be a cornerstone of our response to the coronavirus. And it is so important. It's akin perhaps to SCBA in this metaphor. But all of our other protective measures are that much more important right now because of the potential for breakthrough infections and the known increase in the possibility for transmission of disease due to the Delta variant. So all the things we've talked about historically become so important now, and maybe even more important. We need to screen patients for symptoms that would lead them to be PUIs, and we cannot ascribe those symptoms of dyspnea to something else like COPD or CHF until we know definitively that the patient does not have coronavirus. We have to be relatively concrete in this, unfortunately, but we need to continue screening for symptoms that would make a person consistent with PUI. And I want to remind folks of all of our pandemic response protocols, which remain in place right now. And that includes EMD surveillance and pre-notification. It includes limiting the number of clinicians that are attending a patient, screening again, universal masking of patients, universal surgical mask in all non-PUI and non-positive patients, but assumption of airborne precautions in all PUIs or all positive patients. It also includes documentation so we can do effective contact tracing, decontamination, and communication with the hospital. And I do want to bring up one additional topic, which is that we have seen a number of instances in which individuals in close proximity who were vaccinated and were unmasked in an indoor environment had mini or large outbreaks. So this is from the San Francisco environment. These are 233 hospital workers who were infected. And with Delta, we have to go back to our concerns about maintenance of the workforce and maintaining our workforce so we can continue to serve our patient population. And what that means is that we really need to commit ourselves to masking in stations. Maine EMS's guidance has never changed regarding this. I know that it's hard to message in the context of lots of different public health entities. And I know that the federal message in general has been, if you're vaccinated, you can take your mask off. We are not the general public in EMS. We are an intricate healthcare system that has responsibilities to the sickest and most injured within our community. and therefore we have to protect them. And we protect them by all those other measures, but we also protect them by maintaining our workforce. And part of that means masking in stations. And I know that that is not enviable. I know that's a hard pill to swallow, but we have to get back to that guidance. We have to continue that right now. There remain a lot of questions out there, and I wish we had answers for all of these. The true rate of breakthrough infections right now, we think it's low, but we don't have a true rate. The final rate of breakthrough infections leading to hospitalizations and death, the CDC is starting to give us that information. We're still learning about the need for booster shots or specific vaccines. We're still learning about the durability of the vaccine, and we're still learning about even more variants of coronavirus. We keep your ears open, because there's even more beyond the 4 I mentioned, including a Lambda variant and an Epsilon variant. So lots and lots of new stuff coming along that we're all very dedicated to learning about and communicating about. But the major message right now is that Delta is a game changer. It has changed the landscape of our response. It is responsible for all of the major pivots from the federal and state CDC around masking. It also means for us that we need to double down on our protective postures. And if there was any slippage, we need to go back to being very, very diligent with all of our protective postures right now to maintain our own personal safety, the safety of those we love, the safety of our patients, and the maintenance of our workforce. Why don't I turn these off right now? We can open it to questions either through the chat function or others. Sam, anything to add from your standpoint?
I did mention in the chat that this may mean that in the future, it's not right now, that the MDPB may decide to reactivate the low-risk patient disposition during hospital surge protocol, should these trends continue. So just know that there may be changes that come, and something that we will talk about in just a moment, but we will be having another one of these briefings this month. We had gone back to monthly, but we suspect there will be some changes that come about this month, particularly regarding exposure and testing. So historically, the guidance had been, if you're vaccinated and you have an unprotected exposure, you don't need to be tested. The US CDC has recently received guidance that now, even if you're vaccinated, you should be tested. And so we are working through that information with Maine CDC. And so we may be pushing out a new version of a revision to the playbook, as well as guidance regarding if you were exposed without proper PPE, it may pull people back out of work again, like where we were. Just because we have to keep this under control, and it is so important that people wear masks. And I hear all the time, and I'll be candid, I hear all the time, well, my town hall says that we don't have to wear masks in the town hall. Well, I'm sorry. The town hall is not the fire station. It is not your EMS base. We have to be very deliberate about these policies, because we deal with the sickest people all the time. The town hall doesn't deal with that end-stage HIV patient. They don't deal with the patient who has end-stage cancer that has a terribly weakened immune system. Those people aren't going to the town hall, but you're going into those people's homes. You're interacting with them. You're talking to their families. You're going into the nursing homes. You're going into these facilities, and anything that you can do to protect yourself, it is so important. And I know Maine EMS we're not coming into your station to say, hey, you need to wear a mask in your station, but we are telling you it is so important right now. We're not going to end this unless we really buckle down and do what we need to do. So just putting that out there. I may have stepped on toes there, but it has to be said. And so
Sam, there's some really great questions coming in through the chat. Are you okay if I answer some of them?
Please.
So the first question comes from Jason Oko, who asks, are there any hospitals in Maine seeing a surge of COVID-19 patients? So it's a very great question. I shared with you the national numbers. Just know that our local numbers within the state are relatively similar in regards to new cases. We are at this very moment of time seeing a increase in the number of cases. For those of you who have followed this very closely, we nadered in a weekly average of somewhere in the less than 30 range new cases per day. We maximized out at a weekly rate of about 500 to 600, with events where we saw 700, I believe even 800 in the past. We're back up now to a rate in the 100 plus range per day. And as I mentioned earlier, the number of cases, the rise in cases starts first, followed a week or two later by rise in hospitalizations. So at this very moment of time, we're a little bit behind the rest of the nation right now. I'm not aware that many hospitals are seeing an increased surge on the system right now, but that's something we're watching for and very thoughtful of, because we expect any major surge to occur in the next following weeks. And one more reason to have really good communication through this methodology and others. There's a really great question, another great question that came from Jason. Will an N95 protect EMS clinicians against the Delta variant? That's a great question. Yes, absolutely. All of our protective measures come as a bundle. So an N95 is a cornerstone of that bundle. Please don't forget the importance of other protective measures, including eye protection, gowns and gloves, as well as distancing when appropriate, washing hands, coughing into your sleeve, et cetera, et cetera. But all of those public health postures are absolutely as protective against Delta as any of the other strains we've seen, and in combination with vaccination are a very important part of our public health response. Sam, this is perhaps one that you and I should do together. Chief Davinsky asked, will Maine EMS be issuing communication reinforcing the practice of masking in the stations? Do you want to take that one?
So I did put the most recent guidance that Maine EMS released, which was from May 21st, 2021. We've never changed our posture on masking in stations, but we will continue to reinforce that guidance. I know that there are, I know that the MDPB is interested in writing a bulletin, continuing to reinforce that message. And so you will see something coming out from our office, but essentially it's going to say, we are continuing to reiterate the importance of masking in stations. So yes, you will see something coming out, but Maine EMS has not changed our stance on this. So I just want to reiterate that, and that is in our chat, in the chat as well, if you would like to see the guidance that Maine EMS issued in May.
Ben Wallace asks, what is the vaccinated person's likelihood that they will carry and transmit COVID-19 at this point? That's a very good question, Ben. Let me give, I don't know that I have let me try to answer it this way. We know, based on the information presented to the FDA in the form of an EUA in the November-December timeframe, that both the Pfizer and the Moderna vaccine are about 95 and 94% effective in preventing disease. Disease is the clinical manifestation of infection. And at the time we were doing the town halls, what we knew is that the vaccines prevented disease. We learned later on through some work done out of Arizona and a couple other places that along with preventing disease, the vaccines 2 weeks after the second dose, the mRNA vaccines, were about 90% effective in not only preventing disease, but also infection or asymptomatic infection. And in that case, also diminished the likelihood that someone could be asymptomatic and transmit. We don't yet have, that I'm aware, and I could be wrong here, don't yet have all the information about Delta. But what we do know about Delta is that it causes a very, very high viral load in the nasopharynx and the oropharynx. And that leads to the even a higher likelihood of spread. That's one reason why the R naught is so high. And it's 8, up to 8 from what we understand right now. So I can't tell you an exact number, Ben, but I can tell you it's higher than in the original strain of the coronavirus. And I hope that helps answer that. I just saw Seth Ritter's hand jump up. I don't know, Jason, if we can unmute him so he can speak if at all possible.
I've asked him to unmute. He should be able to select
Oh.
that now.
Yeah, sorry, that was accidental. Disregard me.
Oh, okay. Fred Porter asks, can Maine EMS put that in letter form as guidance? It gives us some backing if needed. Fred, if you could clarify exactly what the that is. I don't know if that
He says, thank you later. We put it in writing already.
Great. Christopher Easton says, just to be clear, the mask is to protect others from you. It's not really to protect you from your patients. Remember, you can carry the virus even if you're not symptomatic. You do not need to spread it to your next patient or your colleague. Yes, the mask does protect you. There is also some protection that the mask offers beyond just you as well. Someone named R. Seberg asks, are the positive patients seen in the EDs sicker or are the numbers just higher? So that's another great question. And clinically, we're learning more about I mentioned this earlier, about not just the transmissibility, but the virulence of the Delta variant. We're still in a rapid learning phase right now. I've not seen anything besides what I'll tell you right now, which is that an early review of information coming out of the UK, it appears as if there's a twofold increase or somewhere around a twofold increase in hospitalization and severity of disease with the Delta variant. So what that means is that, yes, there's a potential for sicker folks if that trend continues across the US and across the world as well. So more to come about that, though, and we're learning more about the virulence of this new strain.
Matt?
Yes.
I received a private question in the chat regarding recent OSHA regulations that have come out. Please note that Maine EMS does not interpret OSHA regulations. However, we have been contacted by the Department of Labor regarding their model plan. There is a temporary regulation, so it's a emergency temporary standard that has been implemented through OSHA, and the Maine Department of Labor is working on a plan that they will be rolling out. And that may include some of this information, may include some of these requirements as well. And this will affect EMS. I can tell you that for sure. It will affect EMS. But just letting you know that we do not write that. That is written by Department of Labor. They did send us a draft version over for us to take a peek at and to provide some comments on. So we are looking at that. But please note that there is an emergency standard that was issued by OSHA. And as soon as that language comes out, you will be hearing from the Department of Labor about that. And as soon as that information is available, we will certainly rebroadcast it as well to make sure that everyone is aware. So just letting you know that that temporary standard will apply to EMS, and just letting you know that that's coming. I don't know when they will be releasing it, but I know that they did send us something over to take a look at. Sorry for interrupting, Matt. Go ahead.
No, do you want to cover the next two questions?
You probably can't answer this question. Are there talks in the state for reinstating masking requirements for the general public? I can't speak for the governor's office. I know that many of the masking mandates that were in place were done through executive action. And that was done under a state of emergency. And I know that since the state of emergency has concluded, there may be limitations on what executive action can be taken. So I can't quite answer that question, but I am sure it's being investigated at much higher levels than myself. So I can't quite answer that. I'm sorry. Pearson EMS exposed, use all but a gown, need testing. The call was a COVID response, tested by a hospital, 12 hours later was positive.
It was called a negative COVID response, Sam.
Okay. So if they used everything besides a gown, but they were wearing all of the other appropriate PPE, such as an N95, and they had an eye protection, the gown doesn't require them to be put out of service or be placed on quarantine. The gown is just, if that happened, they need to make sure that they wash those clothes and they take appropriate action to protect themselves. But if they were wearing the appropriate PPE as far as at least where they can contract the virus, so they were wearing eye and mask, they should be good. But that would be an internal policy for yourself if you want to still get them tested. I certainly think that's reasonable, as we know that the virus can live on surfaces. We know that that does happen. So that would be up to you. But as far as Maine EMS, we wouldn't necessarily be telling you that you absolutely need to keep that person out of work. Okay. John Brady basically alluded to the fact that mandates require declaration of emergency. Guidance from the state does not. So to kind of hit on this slide, and we've kind of spoken about this the entire time, but continuing to emphasize the importance of protective measures throughout the state, continuing to mask in stations, continuing to screen EMS clinicians at the beginning of the shift. If they're working longer than 12 hours, now that's reasonable. So if they're doing like a 13-hour shift, or they are held over, 12, they're held over 30 minutes. That's not what I'm talking about. But if they're working 18 or 24 hours, they likely should have a second screening somewhere in the middle there. The reality is that our health changes, and our health changes, relatively quickly sometimes, and it's good to have another screening. So I know previously our screening guidance had said, twice a shift. If you're doing a 12-hour shift or approximate 12-hour shift, we're comfortable with you screening at the beginning of the shift. But if you're doing a 18 to 24-hour shift or longer, you should be screening approximately every 12 hours to make sure that you are monitoring changes in health status. I know that our guidance has not changed as far as the written policy, because that screening guidance was put out, I think, in April or maybe even March of 2020, and we haven't changed that in writing, but we will be changing that. We will be pushing that guidance out to reflect that screening can happen in 12 hours or so. So please note that you should still continue to be screening. You should still be wearing masks in stations. You should still be wearing masks with all patient encounters. Any patient that screens positive, you should, and that's not screening positive necessarily from dispatch, but screening positive from dispatch or screening positive by the EMS clinician upon initial interaction. You should be donning appropriate PPE based on that patient condition. Matt, does that cover protective measures? Did I miss anything? Okay. I think there's one more slide, Jason. Yeah, so Maine EMS will be putting together another one of these this month. It will be later in the month. We want to kind of take in what we are learning right now. If these trends continue to grow, it may include information regarding the MDPB. There may be information regarding the low risk protocol that was that sunsetted previously because we were entering a phase where we didn't need it, but we may need to pull it back out of the file cabinet again. So that is something that we will be working on. And then we will be pushing out the information regarding screening. And if, or once we have some final clarification from our colleagues over at CDC, we will be pushing out an update to the playbook as well. And so we want to make sure that we have one more opportunity to speak with you later this month so that we can roll those items out as needed. If it's just the playbook or if it's just one thing, it may be that we send out an email, but I think we're really at the point now where we likely will need another meeting this month, just to kind of touch base. And so we will send out invites to email it to the God and Everybody email address, as Jason and I refer to it. So expect to see that, and it also will be posted on our website and recorded. So if you're unable to attend, we will record that. I know that we have also received some questions while I have been rambling on, so we will answer those as well. Jason, did you have anything else around that particular topic before we answer those questions?
No, Sam, I'm all set right now.
Okay. Matt, do you want to start with Claire's question?
Yeah, let's see. So Claire says, just as a point of clarity, if the entire crew has been vaccinated, still recommending masks in the station? Yes. So Claire, great, and thank you for clarifying that. Yes. So again, we're different than the general public because we are such a critical part of our community's infrastructure, and Delta is such a different beast than prior strains of this coronavirus. So what we know right now, we are reinforcing our continued guidance to mask in the station, even if everyone has been vaccinated. And I bring you back to that example I used of what happened in Provincetown with over 1,000 people in a closed indoor environment who came down with a 75% vaccination rate in that population. We also have information from healthcare settings in which this disease has started to spread in enclosed environments. So at this point in time, in an effort to maintain our own safety, our loved ones' safety, our patient safety, and our workforce, if anyone had moved away from the prior guidance of masking in stations, I urge you now to go back to that practice, even if everyone is vaccinated. So Sam, do you want to touch on the next one?
Yeah, and so just one thing with that, Matt, we will revise our operational bulletin to continue so the operational bulletin that we released on May 25th regarding masking essentially said that if you knew if everyone was vaccinated, that you could potentially reduce that based on the CDC guidance at the time. But if the guidance, are we modifying that to say that if everyone's vaccinated, we still want you to wear masks? I think that's the right move. But I just want to make sure that people understand that we will be modifying that a little bit to go back to just, it doesn't matter whether they're vaccinated or not. Because our guidance was, you may not know if someone's vaccinated or not, and it's hard to police. It's impossible to police. Moral of the story, we will provide that guidance in writing. Sorry. Chief Whitetalk said, Sam, in the Department of Labor paperwork we're talking about, does Maine EMS have any push in extending the use or extending the electronic sprayers for disinfecting ambulances without requiring certification? Chief Whitetalk, I can certainly reach out to DOL regarding that. The guidance that I'm speaking of is they're clarifying federal guidance. So that would be a separate thing, but I will certainly reach out to them and ask. Pete says, can you just discuss the use of Buy Next Now kits and if they will be reissued for screening personnel? We certainly can look into the use of Buy Next Now kits. The problem with Buy Next Now kits is, especially with people who are vaccinated, their viral load for vaccinated persons who may contract COVID-19 with, or even the Delta variant, their viral load tends to be a little bit lower if they're vaccinated. And so what happens is that Buy Next Now test may not be as sensitive. So it may not pick it up. And so that is the concern. And that's why they're saying we need to test with PCR testing. So we have kind of broached that topic, but I know the gold standard is still PCR testing. I will continue to have those conversations with CDC, and we will follow their guidance as to what they recommend us to do with Buy Next Now testing. But if they recommend doing it, we're certainly more than happy to let people do it. And if you want to do serial screenings, so if you want to test your people doing serial screenings, there is a pathway that has been defined previously that can be done. Again, what that risk is that you may have a number of false positives, which is going to take people out of your service because they are going to screen positive. And as people are becoming more vaccinated, you may have false negatives, which that's the super scary one we don't want to see. You may see false negatives because their viral load may not be high enough to be detected on Buy Next Nows. So there's some pitfalls with using the Buy Next Nows and using it in that fashion. They're great for population-based testing because of their ease of use. But when we're talking about the healthcare community, their pitfalls can be risky. And so that is something that we need to keep in mind. Dr. Scholl, if y'all are ever exposed, y'all have to do PCR testing, right? Yeah, they all go to PCR testing, even though they have access to Buy Nexts. And masking in the station, can this be any type of mask, surgical or cloth mask? So our guidance is that your masking in station can be surgical or a cloth masking. So you can wear the mask that you have worn in the general public prior to recent guidance. That can be worn in the station. You don't have to wear an N95. How can masking be enforced for general leadership in EMS who simply are not or have not been enforcing masking in the station at all? And so that's a great question. It was sent to me privately, so if people don't see it in the chat. The reality is that Maine EMS, our authority here to tell you, or to regulate or to enforce what you do in the station outside of care or the provision of care of a patient, it's arguably there, but I'm not trying to expand my scope beyond certain points. What will really be impactful is if the Department of Labor or OSHA adopts these guidelines about masking in the station, then it will be an OSHA violation, and that is very well enforceable. And it depends on what OSHA adopts here, because EMS is lumped into the healthcare category, so it very well could be that masking in the workplace is required at all times. I don't know what they will end up doing. I will tell you, we received the 8-page thing this morning, so I haven't read it. So I can't tell you what they're thinking about, but that may be the way that it is enforced, is through Department of Labor standards, and that is their realm all day. So to answer that question, yes, there may be, and violations like that, not protecting the workforce, could have other rippling effects. Just putting that out there. Next question is, oh, it's just a comment. Perfect. Okay, does anyone have any additional questions? I know we just dumped a ton of information, and a lot of changes and a lot of considerations and a lot of things for people to think through. Please do not hesitate to reach out to us. You can email us at Maine EMS, maine.ems@maine.gov. That comes to my email address as well as everyone else on the team. We will triage any of those questions. If it needs to go to Dr. Scholl or Dr. Zimmerman or other members of the MDPB, we will certainly shoot it over to them to answer that question. Please know we are here to support you, and we are here to answer your questions. And we want to make sure that we are doing everything we can to protect your workforce. We know that none of these conversations are easy. Telling your staff to start putting on masks again in the station is not going to be a fun conversation. I hear you. I don't envy you at all in having those conversations. But as Dr. Scholl iterated in the beginning of this pandemic, the reality is this is an iterative approach. We learn more every day. And especially with the Delta variant, we are learning more and more about that every day. And we have to be nimble and responsive to the changes to protect ourselves and to protect our workforce. And so we appreciate your continued patience. Please, please, please take care of yourselves and take care of those who you work with. It's so important, so important. I see Jason put in the chat that we will set a date for the next meeting and let people know as soon as possible, and that we will send out a reminder the day of as well. When we do that, we really want to, we're hoping that DOL, or the Department of Labor, will release their guidance, and we could potentially have someone from DOL on the line to kind of talk about their guidance. That would be ideal. So I don't know what their timeline looks like, but that's what I'm hoping for. Dr. Scholl, do you have any last comments? I don't see any additional questions in the chat.
No, thank you, Sam. And thanks to everyone again for attending today. And please, if there's anything we can do to clarify, reach out to us.
Okay. Jason, any in the text messages?
No, Sam, text messages are clear. I will have this recording posted later today, though, for anybody that's just before 4:30. It'll be posted.
Thank you so much. Please don't hesitate to reach out to Maine EMS. If you have any additional questions, you can email us at maine.ems@maine.gov. Thank you so much for all you do, and we will talk to you in a few weeks. Thank you.